Since the outbreak of COVID-19, we've gained a better appreciation for the value of getting services from home, especially healthcare. 46% of Americans report having used telehealth in 2020, compared to just 11% last year. Thanks to smartphones and secure platforms, people can access mental health consultations from their car, consult about a chronic condition from home, or get quick advice about whether to go to the ER without actually having to brave the doctor's office. By limiting in-person exposure, telehealth keeps both patients and physicians safe, and it allows them to fit doctors' visits into their lifestyles. Yet, a patchwork of regulatory obstacles limit the availability of telehealth. In some states, providers can only offer telehealth if they are licensed within the state of the patient. Regulators argue that they can't ensure that other states hold their professionals to a high enough standard of care. Opponents argue that those concerns are imaginary or outdated. Moreover, a person could legally drive to another state to receive medical services there. Technology has simply eliminated the need to drive. Other states outright ban telemedicine, or they make it impractical by imposing exam requirements that cannot be completed online. For instance, California recently introduced a bill that would require X-rays before receiving teledentistry, regardless of whether a dentist thinks X-rays are necessary. Golden State Warrior player Draymond Green recently spoke out against California's teledentistry bill. Green, who wore braces as a teenager, recalled how his mom struggled to pay for them and argued that unnecessary regulations increase costs and deprive people of access to telehealth. This controversy highlights the debate about the necessity of regulations. Defenders argue that comprehensive in-person exams are necessary to help catch abnormalities. Opponents argue that telehealth is safe and physicians should be trusted to determine whether an exam is actually needed. Telehealth laws sometimes raise constitutional concerns. Because they impose arguably unnecessary and anti-competitive burdens, sometimes for the purpose of protecting brick-and-mortar providers from competition, the regulations implicate due process and equal protection. The debate over telehealth is like the debate over any emerging technology, like ride-sharing, food trucks, or short-term rental platforms like VRBO. The government seeks to regulate the new technology for safety reasons, but it often makes it harder for entrepreneurs to start up and for consumers to access valuable services. Is receiving medical services via the phone or computer so different from traditional healthcare that it requires additional regulations? Or are outdated and unnecessary regulatory barriers standing in the way of a valuable service?